3, 2, 1. Dr. Martin Smith, welcome to the podcast.
Thanks for having me. Yeah, I'm excited to get into it.
Thank you for being here.
Thank you.
We did it. Yeah,
Finally got here. Yeah, it's good.
I thought I'd start with, you as a doctor and tell us a bit about sports medicine and you being a sports doctor.
Yeah. So sports medicine, so it's sort of a similar, it's a specialty within medicine. So it's similar to all the different specialties that people might have come into contact with before. So things like cardiology for the heart or orthopedics for sort of bone surgery or musculoskeletal surgery. So it's its own sort of specialty in its right. So that's sort of where we sit, and it's quite a new specialty. So a lot of people may not have come across it, and that's probably one of the most common things that I hear is I never knew you guys existed or didn't realise what you guys did. So it's quite exciting from that side of things, being a bit new and a bit fresh. So that's sort of what sports medicine sort of is and where it sits. And it's a bit of a misnomer, really. As much as sport is a big part of what we do, a lot of it is a lot more about just sort of using exercise or using strength or using particular activities to try and get people healthier more than anything. So whether that's recovering from injuries, acute or chronic ones, so ones that people have been having trouble with for a long time or quite a short time. But it's really just seeing all sorts of people, basically. Like, again, a lot of people sort of come in and expect it to just be sort of just elite athletes and they're the only people that can sort of get access to us. But for me, the vast majority of the people that I see are normal people. So people, sort of young people below the age of, 18, 25, that sort of age. And then the vast majority of what I see is actually people who are a little bit older or sort of not athletes themselves who just want to get better and get out of pain and get out of problems with their musculoskeletal system and are happy to sort of use exercise or strength to do that. So, yeah, I get a bit frustrated with the name of it because it sounds quite elitist and sounds like we're just hanging around with sports stars all the time, which is really not the case and not the glamorous life that it probably sounds like from the outset, really. Yeah.
Okay. Yeah. So in terms of your practice, you've how is it different to a GP? So you've got GPs go through X amount of years through their studies, and then you've done sports medicine on top, or
so everyone goes through their initial medical training to become a doctor, which can take anywhere from 5 to 7 years of study at university, and then in order to do medicine, to do sports medicine, you have to do about a minimum of 3 years postgraduate studying and training in order to access the training program there. So we're a little bit separate to GPs. So I've never done formal GP training at all. I've done sort of 3-4 months rotations in that field, but without sort of doing pure GP full-time or getting my sort of GP training ticket sort of thing, because that can take, again, sort of anywhere from 3 to 5 years of just full-time GP work to get to that level. Sports medicine, you tend to do a bit of a blend of different rotations through different areas. So we kind of sit in the middle of a lot of different areas like orthopedics, sort of the surgical equivalent of what we do. You do a bit of GP, a bit of emergency medicine, and that's kind of, again, what sort of attracted me to it was just it's quite varied and you can do a lot of, as I say, different things and sits nicely in between lots of different specialties. So for me, it took me a good sort of 5 years, I think, after finishing my medical degree until I started training full-time in sports medicine. And then it's been 4 years subsequent to that of working purely in it. So it's a long road, and it's kind of one of those things where it sounds a bit corny, but you never really stop learning. And I think it's the same with you and lots of other areas where the world at the moment just turns, and new ideas and new studies and new thinking comes so quickly that if you're not staying on top of things, then you're being left behind a little bit. So So yeah, it's always sort of changing, always adapting, always evolving. And as I say, all I do is sports medicine. So just working in the clinic and seeing people and just trying to get them better and living sort of healthy, active lives. Yeah.
Okay. I like what you're saying there about it's not sports medicine and you being your services as a sports doctor is not just for elite athletes or national level or state level performers, but everyday people as well. And you've certainly helped members of our community that are everyday gym people working on their health and their wellness.
Yeah.
Some weekend warriors in there as well.
Yeah.
Was there anything in particular that you can think of that made you, like, how did you know sports doctor was the field for you? Was there a bit of a trigger or what made you get into it?
Yeah, it's a really good question. I don't know if there was like a particular light bulb moment, like some people describe, like one person that they worked with, or a mentor, or a patient, or anything like that. Sometimes people get that sort of light bulb moment. It wasn't really like that for me personally. I sort of noted pretty early on in my training that I liked a lot of things, but I didn't love a lot of things, if that doesn't sound totally contradictory. So yeah, I sort of enjoyed a lot of the different areas, which without even knowing it sort of would become a lot of what I do now during my training. But at the same time, I got quite frustrated with sort of a pill for every problem kind of idea and being really passive with the way that people get treated. So this idea of you have a condition and here's a prescription, and like that idea of being a doctor and I tell you what to do. And one of the big things that I love about my job is like just empowering people and just giving people the information that they need to go out and get better. It sounds like quite a lazy way of doing medicine. But it's all for me about just going like, sort of just putting people in contact with the right people and giving them the right advice for them to go out and sort of help themselves and get themselves, as I say, sort of healthier, better and physically well. So yeah, you hit the nail on the head again. Sort of elite sports is a part of what we do, and probably only maybe 5-10% maybe what I do. Whereas, as I say, the vast majority is, and I find the vast majority a lot more enjoyable, really, just because I feel like sometimes you can make a bigger difference there with as you say, the weekend warriors, the sort of people that want to get better but don't really know the avenues to go down the right sort of path, and seeing that those people get better, like you just get a huge kick out of that, like just seeing people and when they come back and they're just really hyped that they're feeling so much better and able to do the things they want to be doing. There's not many better feelings than that, I think. So it's again, you and the guys here will know all about that feeling, and just seeing that progression and seeing people achieve what they want to achieve, like that's a really awesome feeling to get. Yeah.
It truly is, isn't it? The reward that you get when your client or your patients, you've empowered them with the knowledge. You've started an exercise therapy program. They've gone out and they've done it week in, week out. They come back and their markers have improved. Their strength is up. Their pain is down. It is a truly rewarding feeling.
Yeah, it brings a smile to the face, definitely.
Yeah. As exercise physiologists, we tend to work with GPs a lot more than sports doctors, and I know that when I first met you some time ago,
maybe 4 years ago now.
4 years ago.
There
was I was quick to see the difference between you and the GPs that I have worked with in the past. There are some proactive GPs out there as well that believe in exercise as medicine, or believe exercise is medicine. But I found that you and your team were in a bit of a. It was easier to see the different level in your belief in exercise and movement and the physical therapy side of things as well. And as you say, not just being quick to dispense medicine for for everything.
Yeah, exactly. Yeah. And I think that's a big place that we are probably differentiated from GPs. Like GPs, as you say, do an amazing job, and there are some brilliant GPs who have a hell of a lot of musculoskeletal knowledge out there, and they do a really good job with a really tough set of tools. In the sense of, I quite often come home, and if I've been speaking to GPs or done education events or things like that, I think, geez, their knowledge in my area is pretty impressive. Yet they have such a great coverage over such a wide sort of breadth of subjects. Like, talk to me about I don't know, how to manage a lot of the things that they have to manage in GP world, and I really struggle. Yet their ability to have a great breadth of knowledge is fantastic, rather than sort of necessarily really drilling down into one specific area like I get the opportunity to. So I think, as I say, they do a brilliant job, and there is definitely a bit of an overlap with what we do and what we see, but hopefully where we differentiate is that sort of a bit more in-depth knowledge on sort of how a problem has come about, how an injury's come about, not necessarily just relying on the idea of, if you've got a problem, I'll send you for a scan on it, and then that will tell me the answer. It's a bit of sort of working out, okay, well, what are the things that have caused you to have this problem? Because it's very rarely is it just a one-off event. Usually, if it is, most people themselves can kind of work out what they've done wrong or what the problem is and correct it. Most of the time when people are coming to see me, often it's the case of, you go, well, probably the reason that this thing's developed is because of X, Y, and Z, and we need to work on, like you say, your strength, work on sort of balance, flexibility, all these different factors, whether that involves, as I say, any injections or things like that we need to do sometimes in clinic to try and make that process a little bit easier, but always drilling back to the fact that, to be honest, as you say, you can't go wrong getting strong in a lot of different areas, and that sort of rehab side of things that you guys do really, really well is 9 times out of 10 the fix for most of the problems that I see. So, yeah.
That's really good insight. The fact that you and doctors like yourself and GPs complement each other, and it's a good lesson for our community that seeing a sports doctor like yourself doesn't mean that they have to leave their GP or go, like a lot of our members go, oh no, I have a GP that I trust and I've been working with a long time. I'm like, no, keep seeing your GP. Yeah. But the benefits of seeing Dr. Martin Smith are this, and this is how you would benefit potentially.
Yeah, like that's such an important point, and it's a really good one to pick up on, is the fact that people do come in sometimes and feel like they're cheating on their GP a little bit by seeing me, and
they get nervous about it, don't they? Like,
I don't know if I should tell my GP about this. And I think it's a funny one, that, because it really is, we're very different. You wouldn't get that same feeling about if you saw a cardiologist about your heart, or a respiratory physician about sort of I don't know, sort of asthma or things like that. Whereas people often feel that coming to see me, you might be, as I say, sort of cheating on your GP. But I do the same. Like a lot of, for instance, with the elite athlete work that we do, quite often when it's something that is a GP's bread and butter, I'll say, look, who's your GP? Go and see them. We try and cover a lot of a bit of that ourselves with our athletes, with the elite athletes. But again, I don't know, for instance, which is the best pill to give for certain people, or what's the best necessarily sort of complex asthma medication or things like that, which GPs tend to be really, really good at. So often I sort of say, look, go and see your GP. It's, as I say, it doesn't hurt my feelings at all going to see them at all. And find a good GP is worth its weight in gold at times. And not a sort of competition for me at all.
I'm happy we've hashed that out, because there sometimes is a bit of confusion. The link between exercise physiology and you as a sports doctor, I think, is strong. I've noticed that the approach to management with physical therapy and exercise is there. Do you mind if we dive deep into your role as a sports doctor with other health professionals as well? So us EPs, other physios, and other allied health.
That's good. Because again, a lot of people turn up not really knowing what to expect and what they'll get from coming to see me, really. I don't really get into any of don't do any massage or hands-on therapy like a physio might or a massage therapist might. Or myotherapist or all these other sort of other allied health professionals. And similarly, some sports medicine doctors do prescribe exercises. It's pretty rare for me to do that because I think it can sometimes just confuse the picture really for people, and they're sort of thinking, well, I'm getting advice from one person, be that physio, be that EP, or both, or my friend down the gym, my personal trainer, all these different things. And there's so much noise coming to people at times that, I don't want to sort of muddy the picture. So it's pretty rare for me to sort of say, no. All those exercises you've been doing or all the rehab you've been doing is rubbish, and do these ones and you'll be sweet, sort of thing. So where I think it's sort of, where I come into it is sort of saying, look, what's the problem, sort of defining the problem that you've got, which seems obvious, but sometimes is actually pretty rarely done necessarily. Yep. Sort of saying, look, this is the structure that might be giving you pain, or this is the reason you're getting pain or dysfunctional problems. The other big sort of thing for me as well is, as I say, and I sort of mentioned it already, but the why, as to why you've developed those problems, be it a lack of strength in a certain area, doing too much of a certain thing, or increasing your training load too quickly, all these sort of variables, and then sort of putting people in contact with the right people to get them better. So, and we can do a lot of things in the clinic, as I say, injections, or imaging, scanning, and all those sort of things to either help diagnosis or help that treatment, sort of treatment progression. Sometimes people just find, like, I've just been stuck in a dead end for so long, and I'm doing the rehab and I trust the therapist I've got, and I know I've got the right team around me, but I just can't improve. Sometimes, as I say, things like injections that we can do in the clinic under sort of ultrasound or image guidance, and that's the sort of thing that the last thing they need, just to sort of break through that. Yeah. That sort of window to improve. So that's sort of where I sit, is the idea of, as I say, being very different from, say, a GP, physio, EP, orthopedic specialist, and sort of almost sitting in the middle of that and coordinating things. A really good physio once made a really good analogy to me, which sort of said, when he sort of describes the patients when you need to see a sports medicine doctor, he sort of says, look, if you go and you want to get your floor done in your house, if you go to a tiling specialist, they're going to tell you to put tiles down. If you go to a carpet specialist, they're going to say, oh no, this carpet will look really good over here. Whereas where we sit is kind of almost like being an interior designer and going, okay, well, I reckon based on these factors, that's your best bet to go down. And if that doesn't work or you don't like that, then we've also got this other option. So we don't really have any sort of skin in the game as far as sort of, as I say, saying, oh, you need an operation, and I think you're going to need an operation because I can do an operation. So it's more about going, well, I'm just want to just put you in contact with the right people and put all of the sort of things in place for you to get better. And as I say, that's the sort of the end goal for me every single time. And it's just about doing that for me. And so trying to make patient's life as easy as possible, the treating practitioner's life as easy as possible, and just try and make that happen. So that's sort of, I suppose, in a nutshell, where we sort of sit. And I think you're right. I think it really complements a lot of the stuff that you guys do here with exercise physiology. Because, as I say, I'm not there go and do these exercises or whatever. And especially if I'm sort of seeing clients or patients every, 2, 4, 6, 8 weeks, however long in between appointments, it's very hard for me to sort of say, go and do these exercises, because you might have been doing them totally wrong for 6 weeks, and then you come back and you're even worse, and then I feel bad, you feel bad, and it's just not the right setup for me. Whereas sort of getting in and seeing those people, making sure you're doing the right things with good technique, the right movements, not making yourself worse, and just being a sort of kind of a consultant to that process, so that if there are any issues along the way, you sort of chat to me and we sort of say, okay, well, maybe we need to think about this, maybe we didn't address this, and just trying to put, as I say, those pieces in play in order for people to feel empowered and and fix themselves. Like I don't do the fixing; it's kind of the treating practitioner and the patient that do the fixing themselves, and it's just about making that process easier.
Yeah. I really like what you that analogy that physio has about the interior designer, man. I'm going to remember that. And I think it'll help me.
I don't think I'll have to sort of copyright it or anything.
My patients have certainly found the same thing. When someone's dealing with a debilitating injury, be it back pain, be it an ACL or hip bursitis or something else that's not clearly diagnosed, and if it's in the early stages, it's quite an intimidating and daunting task to figure out what the heck is going on. Yeah. And they see one health professional and go, oh, I think maybe go get an x-ray, and then they come back and then they get x-ray and they're like, oh, x-ray didn't show anything, but then they're like, I'm still in crippling pain. Okay, what's next? Well, why don't I try this, double around with this? Whereas my patients that have seen you in the past, they benefit from that assessment, the diagnostics, and then a management plan and your help and with the advice and management of what the best protocol should be.
Yeah.
As an exercise physiologist, it makes it so much easier for me because the report comes back and then it's a detailed plan of, okay, these systems we need to focus on and this will help with, the bigger picture problem that we're trying to manage.
Yeah.
So
I think it's a good point because so often there's so many sort of, as I say, experts in the area and people that have fantastic intentions and everyone wants to get people better. Like that's just natural. That's why you sort of you do sport and you do your training in whatever specialty you want to go into as well. But often there's sort of things where, for instance, you might get, like you say, an ultrasound or an X-ray or an MRI, and for me, it's almost a bit about a language thing and a kind of a sort of putting it in terms that people understand and what they need to know. Because what we found is, like, studies have shown, for instance, MRI is the classic one, but for instance, with back pain, the frequency that you see people with disc problems, even without any symptoms and without any problems, and I can say this personally, that it's so common to see disc problems on scans or tears in cartilage or tendons or ligaments, and a lot of the time that can be just a variation of normal or a marker of good use. The kind of another analogy I sort of use is it's like your favorite hoodie, your favorite t-shirt. Like, it's not going to look box fresh as soon as it comes out once you've used it a few times, but it doesn't mean it's any less good. And it's a lot of that's the same with the body, in the sense of you get these scans and it can be pretty scary and pretty confronting sometimes when you see the report, and people get access to their reports very readily, which is a great thing to have, again, for empowerment of people. But again, it's about being able to translate that into, okay, well, what is your problem? Because you can get, as I say, using that analogy at the back again, you can get that MRI report that says, oh, I've got this thing wrong and this thing wrong and this thing wrong, and I'm like, oh God, what's going on? And am I ever going to be able to kind of be out of pain?
I'm doomed. It's over.
Yeah.
There's this degeneration in there. Oh my God.
Exactly. And at the end of the day, a lot of the time it's about going, well, okay, yeah, we've got this, whether it's relevant or not, let's put the things in place to make you better. And I always sort of say that, like, the scanning's a supplement to what you've told me and what the examination features show, and it never really ever tells me that if it looks catastrophic, yet I've seen it plenty of times where people have got backs and you go, oh, that would be pretty sore, and you do an intervention or you put them in contact with the right people and they come back and say, look, I'm great, and it's in your head you go, geez, I can't understand that. Like, it doesn't make sense seeing what I've seen, knowing that. But it's the body's a complex thing, and it's not as simple. You have pain, you get a scan, that will tell you immediately. It's often, as I say, almost like learning another language, like being able to kind of take that information and convert it into, okay, well, what's relevant? How do I translate that from what I know and from looking at the images, what I think is relevant? Because again, radiologists have a tough time when they report those MRIs because they haven't seen the patient themselves. They've not seen where they're sore or how they move or all these things that we get the privilege of seeing. So they've got to report it's almost like, again, using that sort of language analogy, sort of saying, okay, well, convert this into French. And I know from my school times, if you just plug that into a language converter, you're going to have a few things that don't get translated right. And it's pretty similar with this in the sense of, yeah, you can kind of get a good idea a lot of the time, but a lot of the time we might find stuff that's totally irrelevant.
There's more to it, yeah.
Yeah, and it's about looking at that in relation to the person in front of you and how they're moving, where their strength is, and all these sort of things.
Fascinating, man. I find it fascinating. Absolutely. Like it's nuts. You know, you see a report and like you say, you're thinking, whoa, this person must be, surely they're going to present terrible. And they're like, nope, I'm managing fine, da-da-da. And then you see another one, everything's looking clean and crisp. And then they're in debilitating pain.
Yeah. That's it. Yeah, it's the body's a strange thing, and particularly the brain and its way of interpreting those things. So, yeah, I think as soon as it's one of those things. As soon as you think you're starting to get a grip on things, it will just pull the rug out from underneath you and sort of say, well, and surprise you all the time. And again, that's I'm sure you sort of feel this as well. But that's kind of, again, part of the enjoyment of the job is kind of that constant variation, constantly being surprised and having to be on your toes and try and think outside the box sometimes.
You mentioned off air that lower back pain is a common thing that you guys deal with, and certainly in a gym environment and in our clinic, lower back pain is super common. Yeah. Who are you having present with lower back pain?
Yeah. I mean, all sorts, to be honest. There's sort of using that the idea there's sort of two groups of different people, and it's not necessarily that there is two groups, but you get the elite kind of people who, and that can even be not necessarily sort of professional, semi-professional athletes. It can be people who are sort of elite from the aspect of their training at elite levels, which lots of sort of normal people and people with full-time jobs are. And they obviously tend to get a lot more of those overuse kind of conditions and stress fractures of the back or overuse conditions relating to the back. And that can be one presentation, or it can be, as I say, the sort of quotes normal people who have back pain and develop back pain related to work or certain positions or activities they do, or just the sort of thing that's developed over time, and they can't really put their finger on why it's come about. So lots of different types and source of back pain. And I think personally, that's one area as doctors, as a group, we're pretty poor at managing, really, in the sense of, I think probably education in medical school isn't great for back pain. There's probably not a lot of real empathy at times, I think, with back pain, because there's a bit of an idea of, if you have back pain, take some painkillers, go see physio, go see exercise physiology, do some rehab, and that's all I can really offer you. When actually there's so much more to it, and grouping, as I say, both those kind of patient cohorts into just one homogenous kind of group where you just say, okay, you've got pain related to your back. We don't do that with any other area. It's not like you sort of say, oh, you've got shoulder pain, like off you go sort of thing.
Deal with it.
Yeah.
Put up with it.
Same with knees, like any joint. We don't really do that anywhere else. Yet the back, for whatever reason, seems to get a bit of a bad rap, I think.
That's so true. Yeah.
There's once you get a diagnosis, as in a sort of tissue, an anatomical diagnosis to sort of say, well, I think your pain is coming from this structure or this area, then it can give you guys a lot more to sort of go with, because okay, well, these are the sort of activities or movements or exercises which are going to make you worse, and this is what we need to work on strengthening. And the sort of old school idea, I know you guys will sort of agree with me on this, of just work on your core and you'll be right. It works in some cases, but doesn't necessarily hold true particularly. And there's a lot of fear with back pain as well, because of, again, culture, society, and what people sort of see, and they see people walking around with walking sticks and backs. And so as soon as they, again, linking it back to that MRI report, they see the MRI which says degenerative disc disease, they think that's where their mind goes to. And that plays a hell of a lot into the way you feel your back pain and your approach to it, and that idea of, well, there's not much that's going to get me better, so this is something I'm just going to have to live with, rather than it being, as I say, you wouldn't necessarily think that about if you found that you had some tendon inflammation, tendon tears, or I don't know, you'd sprained your ankle in the past. You wouldn't suddenly go, well, I expect my ankle to be rubbish for the rest of my life. Yet, again, we do it with backs. So, yeah, I think it's an area that probably, as doctors, I think we need to pull our socks up with a little bit more. And as I say, there's so much that we can do to try and get people better and doing what they want to be doing.
Yeah, couldn't agree more, man. I could chat about lower backs all day. You've mentioned that the assessment and diagnosis is a good start. The psychological, lack of a better word, psychological damage that comes with the patients just misinterpreting the information. Yeah. What about the patients themselves and us as the physical therapists? What advice do you have for us for encouraging and empowering patients? Obviously, moving better and helping them manage their fear avoidance and the confidence with lower back pain. Is there any other big hitters that you could suggest that you see in the clinic?
Yeah,
for management. Yeah,
I mean, again, the first thing you said was the most important, and it's about desensitizing or de-stressing, sort of avoiding that fear of movement, because as I say, I don't know whether it's something that we're taught, it's a cultural thing or what it is, but as soon as you have pain from your back, there's that kind of feeling of, oh, I'm unstable, I need to protect this, and it's painful every time I move, and that generates a lot of fear. Whereas what we do know is that your back is incredibly strong, and even in sort of, as I say, those conditions where we see sort of significant problems or damage, for want of a better word, seen on an MRI, movement is still sort of a thing which is going to benefit you. So motion is lotion is a thing that I think, not me, I can't claim that. I think something like maybe Lorimer Mosley, who's a pain specialist, has spoken about a lot. But yeah, that idea of like movement, whatever you can within your pain-free barriers is safe and is going to be good for you, and it's not going to be causing any more damage. And that's probably the big thing that I try and really push for, that if there's going to be certain things that people are going to take out of when they walk out the door from seeing me, is the idea of, as I say, almost trying to remove that fear about the problem that's going on. And so, yeah, knowing that you're not going to be causing yourself, if you're being sensible, you're listening to your body and you're moving within guidance, you're not going to be doing yourself more harm. So the way we sort of approach back pain is using this idea of this biopsychosocial model, which basically means that you've got the biology of things, which is the anatomy and the structure and the problem that's there. You've got the psychology of it, so how you perceive it, your feelings about it, and then you've got the social. So who have I got to support at home? I've got to keep working, all those other things that come through. And if you only treat and address one of those problems, then, in some cases you're going to go all right. But in other cases, you're just not going to get anywhere. And unless you sort of address all those factors, that's the most effective way of sort of getting people better. So sort of saying like, as I say, a lot of the psychological side of things is about going, look, if you have pain, that's okay. Like, it doesn't necessarily mean that you're causing yourself damage. Because, I mean, again, I could talk to you for hours about this, I'm sure, but pain is not necessarily a marker of damage in our bodies. It's a sign of the body wanting to protect you. And in some cases, it's that the body, just almost like a thermostat, is just cranked up a little bit higher. And so movements which shouldn't necessarily give you pain, your body responds and your brain goes, I'm just worried about this. I'm not gonna let you do that, because I don't know if it's gonna cause damage, but I just don't want to take that chance. It's like a worried aunt sort of thing. Yeah. And so a lot of it's about sort of going, well, let's just, like almost like a phobia, kind of go, well, let's just slightly, like, let's de-catastrophize this. Let's move within pain-free areas and maybe push into a little bit of pain, and then your body might realize, okay, well, that wasn't actually so bad. Similar to the analogy, again, I use quite a lot, is when you go to the gym, like this place, like you'll feel sore the next day. If you've pushed yourself relatively well, you'll feel sore the next day. Yeah. Have you injured yourself? Have you damaged yourself? Have you caused yourself more problems? No, you've actually kind of, not that I want people to push into heaps of pain by any means, I've got to caveat that, but pain doesn't necessarily mean you've hurt yourself or damaged yourself. In order to kind of, to improve and get healthier and get stronger, you have to have a little bit of pain, but it's about making sure that pain isn't excessive, and just sort of that, education and making sure that people understand the nature of their problem, and that, as I say, at the end of the day, moving and getting stronger is going to help you, and just putting you on the path to recovery, really. So that's sort of, regardless of what the biology is in back pain, that's sort of a big part of what people should hopefully take out of anytime they sort of meet myself or other practitioners, is that idea of, like, your back is not unstable, your back is not damaged irreparably. Like, there's still a lot of things we can do to get you back to doing what you want to be doing.
Fascinating information about back pain and management. The power of movement, and in the gym and in our clinic, we see a lot of patients that come in and they with the fear, they might have hurt their back. Last time they were doing a squat, right? And then they come in and they go, oh, no. Squat was the trigger.
Yeah.
No, I can't be squatting. And then when we deconstruct and break it down, and then we help them understand that they're actually performing squats in everyday life. Yeah. Lots of times every single day, and that it's okay for us not to, worry about. I mean, the worry is warranted, the pain, and then we bring it back down. Help them learn how to move again, help them how to load safely, get the progression going, and the results are huge. I know that before COVID times, you were traveling a lot, and I'd see you popping up here and there with all sorts of different sports teams. So when you're not in the clinic and when you're not helping patients with injuries, who are you working with, and what are other highlights that you've had with your career so far?
Well, I mean, I always feel a bit awkward talking about myself like that, because, as I say, the reason I sort of do what I do and is for normal people and normal patients, and, as I say, seeing people improve is like, that's the best part of my job. The sort of the other side of things, as I say, it might sometimes seem a bit glamorous when you see sort of the photos on Instagram or hear about the stories. It's not always as glamorous as it sounds, but, as I say, the things I really enjoy is sort of, as I say, seeing people get better. I think probably highlights so far. I've been really, really lucky through working with great people and meeting great people and opportunities and things. I've had some amazing opportunities to, as I say, travel and work with some really amazing people. So, I mean, State of Origin would be up there. It's like, sort of doing that for 3 years as sort of the assistant doctor role, and in the Maroons camp was pretty special.
Nice.
There's nothing quite like that feeling, not being a player at all and being an incredibly average sports person myself in my youth, of just hearing that noise at the Suncorp on a State of Origin night is just unlike anything I've ever can probably put into words. What else? So working with the Gold Coast Titans, this is the third year of working with them, and a fantastic group of people there and a great club. Looking after a Bledslow Cup match, so Wallabies against the All Blacks at the Suncorp as well was pretty special. And then the travel-wise, in end of last year, I was lucky enough to go away to Brazil and Chile with the Australian under-17 soccer team. So that was for a World Cup, and I think as much as maybe my accent betrays me, sort of walking out and hearing the Australian national anthem and seeing the young fellas sort of representing their country and the pride of that and sort of traveling around and seeing those beautiful countries was pretty special as well. So they would probably be the top things. But, as I say, kind of the thing that I probably get the most enjoyment out of, as I say, is just seeing people get better. Like it's just, I think I've got the best job in the world personally. And I know a lot of people sort of might say that and might think that, but I think I'm incredibly blessed to do what I can do and see people get better. And I think at the end of the day, that's what it all boils down to for me. And that's like, I think that's why a lot of people try and get into medicine, is to see people get better and want to help people. And I'm just really, really lucky that I've found that niche that works for me, and I can see that sort of day in, day out, and work with motivated people who want to get better at the end of the day. Like that's the thread that feeds through elite sport and population who come and see me in general, is just all of them come in and go, look, I've got a problem, I want to get better. Yeah. How do I do that? And as much as I think I play a pretty small role in that, as I say to people when they come and see me again, like I don't do a lot of the fixing, I just put the things in place for you to go and do it yourself. And yeah, as I say, that idea of rather than being really passive with here's a pill, come back and see me in so long, for me it's all about giving you the weaponry to go out and tackle it yourself and be confident that this is the right track and this is what I need to do to get better, and I'm going to go and fix it myself. Like that's awesome. It's such a privileged position to be in, basically. Yeah. It's
a very nice thing, that empowerment of when the patient has a plan, and then everything's in place. They're then able to get after it, work hard, and then get the rewards really with their health and their wellness. Yeah. One thing that I'd like to explore with you is the overlap between that sports performance, elite level, working with the Wallabies, with the national soccer team, etc., and the clinical population, the everyday weekend warrior, or is there any key points that you draw there, that commonalities that you see of things that these athletes do well that could help the everyday person as well? Whether it's any good recovery advice or any trends or anything like that.
Yeah, it's a good question. I mean, as I sort of mentioned before, I don't think like the thing that probably, I mean, I've learned a lot since doing my job, especially with the sort of elite teams that I've worked with, is that the people are just normal people. Like you look at the posters of people around, and you kind of go, oh well, like they're an impressive individual and they're an impressive specimen, but they're just normal people. Like we're all humans at the end of the day, and they've got an amazing set of skills and that sort of thing. But the medicine and the way of treating those sorts of people doesn't really differ a lot from how we treat normal people, particularly people who are, as I say, working full-time and still training a lot alongside things. Like the injuries that you get, the problems that you encounter are pretty similar. What the athletes and what professional athletes have access to is that sort of speed of being able to get in and dedicate their entire focus to that. So that idea and of being able to kind of go, oh, I'm a bit sore, I'll just call the physio, and then within 15 minutes I can be on the table getting assessed or getting treated for whatever it is. Like it's that access which is the only real difference. Okay. As far as what they do well, for me it's probably the recovery. As you sort of mentioned, it's the idea of probably the best athletes that I've worked with, and a lot of them obviously tend to be the ones that have been around for a long time and have that experience and have experienced injuries or different sports or different high performance settings. It's a mindset thing. It's an idea of when you're in your sort of early 20s, you can bounce back. You can suddenly just go, I'm going to play soccer and I won't pull up sore afterwards. I'm indestructible kind of thing. And as we get probably through our 20s onwards, you start to notice like, oh, I'm pulling up a bit sore off that, or I can't go and play basketball because I know I'm going to pay for it the next day. Whereas, so you just know that recovery side of things is so much more important than listening to your body and sort of going, well, I know I'm a bit sore here, so maybe not doing that thing, or actually having a rest day can be as important as training sort of thing. So the recovery, at the end of the day, what you do in the gym might take 1 hour out of your 24 hours in a day, yet you've got the rest of your day that people often neglect as to what they can be doing. And that can be things that put stress through their body by sitting all the time and not moving, not doing their right recovery, not stretching, not triggering, all these sort of things. And people often sort of go, well, the focus on how I'm going to get better is all here. When actually, you've got a hell of a lot of time outside of the gym setting where you can be doing a lot of stuff that's going to be making improvements. And diet's obviously a big thing. Sleep, I can again talk to you for hours about sleep and the importance of that. And yeah, sort of diet, recovery, fluids, all these sort of things. So often people sort of ask me when they come in with an acute injury, is there anything that I can particularly eat or take or do to speed this process up quicker? And actually at that point, it's almost like that's sort of the worst time to think about this. When you should be thinking about that is when you're almost at your good level, because it's going to help you prevent injuries a lot more if, as I say, you're getting enough sleep, you're eating right, you're staying hydrated, you're doing the right recovery things. It means your likelihood of getting injured is so much less, like sleep being a big thing for that. Yet we often kind of go, well, if I train really well for this hour and then I go and drink 6 schooners at the end of the day with mates and all these sort of things and sleep 6 hours and then just get straight back into work, you're probably undoing all the good stuff you've done here to a certain extent. So it's that idea of not being passive in your recovery and just making sure that rather than looking for like those 1%ers, as far as taking a certain vitamin or doing certain things or going to any sort of specific recovery thing, you turn around and go, well, do the basics well, sleep right, eat right, drink right, all those sort of things, look after yourself, and your likelihood of getting injured again is so much less. And when you're injured, the body has a biological sort of clock on. There's not a lot we can really do within reason to speed that process up. It's not like we can often convert injuries from an 8-weeker to a 4-weeker. I mean, as say in elite sport, you get that opportunity because they're coming in, getting physio every single day and getting all of that access around them. But at the same time, there is a biological lockout time in that point, whereas where you can really make a big difference is making sure you stay right. And that's from, as I say, doing all that stuff that seems boring and simple, but doing it well, basically. And we talk about 1%ers, but those things are bigger than that.
I think that's really good advice for our wider community. The importance of it's not always go, get after it in the gym and then forget about it, but know when to take a rest day and focus on recovery and and hydration.
Yeah, and even things like the Pilates things that you guys have got here and stretching and flexibility and triggering. Like you can come to the gym and you don't have to be shifting tin downstairs here. Like you can be doing the simple things, which is going to make sure your body stays right, sort of thing. So like you say, life and is busy and we often don't have time for a lot of these things. And I can say personally, like the idea of sitting on a foam roller for half an hour doesn't exactly excite me like lifting some weights does. But at the same time, it's probably just as important at times.
Dr. Martin Smith, thank you for your time. This is a good opportunity for us to end it. For our audience and community, where can they find you on social media or and in person if they need you?
Yeah, so I'm probably not the best person as far as social media goes. Probably anyone that follows me would find it a little bit boring. I try to occasionally post sort of stories and photos from interesting things I've done, but COVID's slightly curtailed that at the moment with a bit of lack of travel. And,
I follow all of the sideline stuff, mate, the State of Origin with the Titans.
Yeah, so there's that. So yeah, that's at My Sports Doctor there. So that's on Twitter and Instagram. And then, to come and see me in clinic. So it's at QSportsmedicine in Hurston in Brisbane. And just Google us, give us a call if you want to come and see it. If there's any problem that's been nagging you for a long time, we'll try and get that thing sorted.
Thank you very much. Pleasure. This has been a powerful chat.
Awesome.
Cheers, mate.
Thanks, mate.